right, hello everybody. We're going to be doing lower extremity manual muscle testing now. So I'm going to start at the very top with the hip, but we're going to incorporate hip, knee, and ankle in this video. So as you're filling out on your sheet, all the information you need to, so gravity minimized, against gravity, where the support would be, where the palpation would be, and then of course where your stabilization and resistance hand will be. It's going not to go in the order, but in the order that makes the most sense with the patient and not having them switch positions so much. So you can stop the video, you can fill out your sheet as we go. All right, so the first one I'm going to have, William is my patient, my nephew, so graciously offered to be my patient today. First one I'm going to have William do is test iliopsoas. So iliopsoas is a hip flexor, so we're going to have him perform the action. So William, what I want you to do is just reach back and support yourself here. So you want them to lean back to open up the hip joint a little bit more so you have more range of motion to play with. And when you have them do hip flexion, you want to make sure, so if I'm testing the right, that it's in the right alignment. So make sure you have neutral hip. So William, the motion I would like for you to do is just lift, just like so. Okay? So I'm going to test against gravity, a 3 here, so go ahead. Seated position. So he's a 3, okay? Now, after we've done that, we're going to do a brake test. So now we have to put our resistance hand. So I'm going to be on the opposite side, okay? This is going to be my stabilization hand, the other extremity, and I'm going to have him come up and meet my resistance, and don't let me push you down, okay? So come up and meet my hand, and I'm giving him min, mod, max, resistance. He's obviously a 5 out of 5. Okay, so that would be against gravity brake test for iliopsoas. Great. Okay, are you comfortable like that?
Yeah, I'm fine.
All right, so now we're going to do quadriceps. So quadricep muscles going to the knee. Since he's seated, I'm going to do all the seated things that I can do first, which would be how you would perform it in clinic. So the motion I would like for him to do, just like that, is just kick out. And sometimes we have to put a target here for our patients to make sure they do enough. Range of motion, so I just saw his range of motion against gravity. So he's a 3 right now, and now I'm going to perform the brake test. So, and here's where you really have to make sure they stop before end range, because if they lock out their knee, then it's not an adequate test. It's easier for them. So I have to stop him at that 45-degree or so angle. My stabilization's on the opposite extremity again, and he's going to come up and kick into my hand. Don't let me push you down. 1, 2, 3. I'm just saying that in my mind, and to you to think min, mod, max, resistance. Okay, so that was his brake test. He, of course, is a 5 out of 5. Remember, at any point in time, if the patient starts to waver, so let's say he was here and he started to waver as I pushed, wherever he wavered or broke, that would be his grade. So make sure you're reviewing your grades as you're going through this. So if he, for example, was a 4 out of 5, he would have broke at my moderate resistance, okay? All right, so next thing we're gonna do, since he's seated, is external rotation and internal rotation. I'm gonna get my towel roll, and I put it under his extremity so that the rotation is so, and of course I'm checking the alignment, so the rotation, that femoral joint is spinning nicely in the acetabulum. So the motion for external rotation, I'm going to show him what I want him to do, is just like so. That's external rotation. So I'm going to ask him to do that motion. I'm going to watch it. Now you see how he lifts a little bit here. That's a compensation to get more motion. So I'm going to say to him, perfect, you did it. I'm going to say, don't go as high, just go as much as you can without lifting this part of your leg. And if I have to stabilize a little bit, but he did great, then I would, okay? So now I know exactly where I'm going to put my hand because I saw his range of motion. So I'm going to give him a brake test. My stabilization hand is on the lateral side of the femur, and the medial side of the tibia will be my resistance hand. So come up, meet my hand, don't let me push you down. Hold it, hold it, hold it. Okay, so my hold it, hold it, hold it is my little cue. That's my min, mod, max. The other direction, so from here to here is going to be internal rotation. Okay? Again, I'm saying the motion, but review the muscles in your handout and in your mind. What does what? Okay, so my break test hand is medial side, my stabilization hand is going to be medial side of the knee. Lateral side is my resistance hand, so come up and meet my hand. Don't let me push you down. And good, okay? So that's your break test for your internal and external rotators. So now we can do, don't forget the towel for those rotators. Now we can go down to the ankle. So the one we can do in sitting is dorsiflexion. So he's going to, I'm going to have him lift his toes as hard or as high as he can and lower them down. Okay, and you can start in plantar flexion, so we have a lot of gravity here that we can create full range of motion against gravity. Okay, so you're always looking at how much range you can get. So go ahead and do that for me. And there's your 3 out of 5. So now I will perform the break test. My stabilization hand is going to be on top of his thigh here, and I'm going to probably about neutral position. I'm going to place my resistance. It's going to be on the dorsum of the foot, so come up and meet my hand. Don't let me push you down. And there's your 5 out of 5 again. Okay, great. All right, so I've done all I could in seated position, so we are going to go to side lying position. So William, what I'm going to have you do is lie down but face on your side that way, on your left side. Okay, so I'm going to move this out of the way. Now you can have your patient flex their knees, so flex your knees. Okay, because that's going to help with the rotation aspect. So, of course, if we were positioning, I would use a pillow under the leg, but we're not right now. When I get to the ankle, I will. But what I'm going to do is I'm testing his hip muscles first. I'm going to do iliopsoas because this is gravity minimized for that muscle. So, I'm just going to have you can relax your head. Let me get your pillow to support you. Make your patient comfortable. Come towards me, back up just a little bit here. Yeah, there you go. Okay, so for iliopsoas, we know it's flexion. So the hand hold I like to do, so remember this is a weak patient. They wouldn't be able to hold up their leg. So you want to keep a neutral hip. So I have to support femur, so you see where my hand is here, and I'm also supporting tibia, because if I don't, what's going to happen is he's going to drop. He's going to drop into external rotation, and we don't want that. We want neutral hip, no rotation, or he might drop with his knee this way into internal rotation. So we want to level him out. And I'm going to stabilize his hip here. I know it's gravity minimized, but if I keep my hand here, it's always good so that he's not rotating. So I'm going to bring him back into, relax your leg just a little bit so I can manipulate it. All right. Give it to me. Give it to me. Relax. Relax. And it's hard to relax because he's helping me, but that's okay. So, all right, so for flexion, I'm going to show him this is the motion I want you to do, okay? So if he was really, this is a 2 out of 5 position, he would be weak, and I would be supporting him, not helping him through the motion, supporting him. So go ahead and do that, knee to chest, good, as much as he can. So that's his full range of motion. 2 out of 5 has just been done. Now I want to do 2 plus out of 5. I'm going to pull back with my fingers. Remember, it's like a 2 plus out of 5 is like a minimal resistance throughout the range, almost like a 2-finger resistance. So now I want you to do that again. I'm going to give you a little resistance as you pull. Okay, so go ahead. Okay, so now he's a 2 plus. Now he's a 2 plus. Okay, so I just did iliopsoas, gravity minimized position. All right. For I forgot to say palpation. My hand was here because I can palpate, but it's deep. Very deep to palpate iliopsoas, but you would feel that ASIS and kind of dig just medial and distal to it, and you're going to feel the obliques kick in anyway, so it's a very deep muscle, hard to palpate, but that's where your hand would be for palpation, okay? All right, so the next one, since I did iliopsoas, I'm going to do the opposite direction for glute max. So this would be gravity minimized for gluteus maximus. So this time, what I want him to do, thanks for holding up your leg, is go from flexion, bring it down just some, okay, all the way to extension, okay? So I'm going to palpate glutes. So I have my thumb here. I'm always on the iliac crest for rotation purposes, but I have my thumb. So from here, so go ahead and do that motion for me, William. Back. Good. Okay. Try to keep that knee flexed. Good. So now that was a 2. I'm going to do a 2+ out of 5. So what I do is, if you can see my hand here, I just kind of hook my thumb to push back and give him some resistance as he's going into extension. So now I'm going to bring him here. Go ahead, I'm going to give you some resistance. And I push him as he's pushing back towards extension. I'm pushing into flexion. Okay? So that's your 2+ muscle. Great for your glutes. Now I'm going to go to the next joint I could do in this position. And it would be knee flexion and extension. I'm just going to get a pillow here. Because now I don't have to move the entire leg. I'm only moving the lower leg. So I can give support to the femur with the pillow. So just raise your leg up for me. So I'm going to have him here. Now I just have to worry about his lower leg and support. Okay? So for quads, well, you can see that. For quads, obviously I'm palpating quads for a 2 and I'm having him extend his knee. You see that, Shan? Mm-hmm. Okay. All right, so I showed him what to do. I'm going to palpate. He's going to kick out himself. I'm just supporting. And now I'm going to, that's a 2. Now I'm going to give him resistance for a 2+. So do that again. I don't need my palpation hand. I can move it. But I'm resisting, pulling back into flexion as he's kicking out into extension. And the opposite direction. So if I want to do hamstring test, I'm going to do 2 out of 5. I'm going to palpate hamstrings here. So if you have your patient's in shorts, it's perfect. Move the shorts, make sure you make contact with the skin so you can really see if the muscle is engaging and contracting. Because of course we have, if they don't move, we have to decide, are they a 1 or are they a 0? Am I palpating a contraction or not? So go ahead and do that. Sorry, I didn't even show you what to do. You knew what to do. So this is the motion I want for you to do. Okay, so he's going to do flexion from full extension, and go ahead and do that. And I'm just supporting and palpating for a 2. Now, if I want to give him some resistance, I'm going to push back into extension as he is flexing. So go ahead and do that again. Good. And that is a 2+. 2+. Okay, so we did knee extensors, knee flexors, and now I'm going to get another pillow. And I'm going to move down to the ankle to see what I could do in a side lying position for the ankle. Okay? And then we'll go back up and do hip abductors, adductors. So at the ankle, okay, you can support the full lower extremity. Again, the bottom one is flexed so that they can stabilize themselves from rotating. So if I have, okay, the knee extended, on the back, on the posterior side, I am doing gastrocs. So if I want him to do this plantar flexion, I'm going to go from full dorsiflexion, which he doesn't have a lot of dorsiflexion. So this is all he has. Some people have more. So if he does from full dorsiflexion, I'm supporting medial side of his foot, and I ask him to do plantar flexion, and I palpate the gastroc heads. That would be your 2 out of 5. So go ahead and do that for me. Good. So there's your 2 out of 5 for gastrocs. Now I'm going to move off the gastrocs, stabilize a little bit, and I'm going to give him that 2+ resistance through my thumb on his plantar aspect of his foot. So go ahead and do that for me with a little resistance. That's your 2+. Okay? Now to do soleus, I would take out the gastroc activation and I would flex the knee joint. Okay? And now I could do the same thing, but I'm going to palpate. And Shannon, I'd like for you to get right where I am with my palpation hand. Because there's the gastroc heads. I want to go slightly distal where it flattens out to really feel if the soleus is engaging. So we know it's deep to the gastroc, so I can palpate a little bit better down here. And again, we're doing dorsiflexion to plantar flexion. So I'm going to ask him to support his foot. Do that motion for me. While I palpate, he's a 2. Now I'm going to give him resistance. I'm going to stay away from the palpation. I'm going to ask him to do that again with resistance for a 2+. And that's a 2+. We can leave the knee flexed, and we can do eversion here. Okay, so I'm going to see how much eversion he has passively and show him the motion. A lot of times you want to show the patient the motion passively. They're not activating their muscle if you do it passively, but they get the action, they feel it kinesthetically to the action that they want to do or you want them to do. And this is a difficult one, so it may take a little bit of time. Peroneals are here. Those are the everters that you would be doing in against gravity position. So I just have to show him, William, this is what I want you to do, okay? So this is called eversion, all right? And I just want to, since it's against gravity, let him do that. Go ahead and do that motion, okay? And so he just performed a 3 out of 5, all right? Again, this is against gravity. Now I have to do a brake test and meet him halfway. So it's going to be on the lateral portion of his foot by the 5th met. And I'm going to stay off the peroneals for my stabilization, go above the knee joint, and I'm going to ask him to come meet my hand, don't let me push you down, and give him my mid-mod max resistance to get to that 5 out of 5, okay? So since we're down at the ankle, let me just go to the bottom foot, okay? So now, and that's going to be a little bit challenging, but you could do it. If you could just get your foot off the plinth a little bit, so just scoot yourself down, okay? Yep, that's good. Perfect. So now, if I'm working with this foot that is closer to the plinth, so the bottom side, and I have him do this, he's doing inversion, okay? So, yep, he just did it for me, so he already now is at 3. So if I was going to do a brake test, because this is against gravity, I'm going to meet him halfway, and I'm going to be on the medial side of the foot for my resistance. I'm going to stay up here. He's pretty stable, just in case. So come up, meet my hand. Don't let me push you down. Good. Okay. And that would be a brake test for the inverters. Okay. Now I'm going to go back up to the hip. I'm going to remove the pillows, and we're going to do abduction and adduction. So I'm going to remove the pillows. Thank you, William. Okay, I could still have him flex a little bit more on that bottom leg to keep him from rotating. Now I'm going to concentrate on the abductors on the affected side, which is up. I want to make sure he's not rotating because he already was starting to rotate back. A lot of people do, and that means they're going to engage their flexors in order to achieve abduction. But what you're really looking at is what the glute med is doing. So you want to isolate it and make sure that it's exactly the legs lifting perpendicular to the plinth. So I'm going to put him in the right alignment, make sure his hip is in neutral, no rotation, and now I'm going to show him the motion so that he feels what I want. So that is abduction, William. So can you, just a little bit this way, can you do that motion for me? Perfect. Okay, good. He didn't rotate. My hand was here just resting just in case I needed to get him in position correctly, but he did great. So now I'm going to do a brake test because this is against gravity for his abductors. So my stabilization hand is at the iliac crest. I'm going to go proximal to the knee joint. I know the iliotibial band is here, crossing the knee joint, but you want to be proximal with your resistance because you don't want to involve the lower leg crossing the knee joint. It can push that knee into a valgus or varus position, which is not good for the knee joint. So when he comes up, I'm going to hit him about neutral. Hip, he had a lot of range. I'm going to ask him to come up, meet my hand. Don't let me push you down. Hold it, hold it, hold it. Now I want to give him enough resistance max. So I put my body into it, so don't forget to use your own body weight for the bigger muscles. Okay. Now, I'm going to switch and now do adduction because I need the leg that's down. So I'm going to ask you to just put this leg just like this. Now, he's flexible enough to do this, so I can work with the bottom leg. Those that are not, you'd have to hold the leg, so I'll just show you really quickly. If I had to support his leg like this, to let this leg do adduction, I would. Or sometimes we get a stool and or a pillow and put it right here to support the leg out of the way. But since he can do it, I'm going to let him do it. Okay. So, all right, William, what I want you to do is just, without rotating, keep it just like so. I'm going to ask you to lift.
Okay.
And put it down. So it's a short range, but he can do a 3, okay? And now I'm going to come back here to his pelvis on his iliac crest, and now I'm going to, again, proximal to the knee joint. I know the adductor magnus is there. I'm going to place my hand as close to that femoral condyle as I can get, so not to really put resistance on the muscle belly itself. So you're going to come up, meet my hand. Don't let me push you down. Hold it, hold it, hold it. Good. You're still a 5. I haven't had one weak muscle yet. Okay, so I went to the ankle already, so I think that's it for side lying. I will check my sheet though. Okay, you can pop up and sit. Make sure that I got everything. All right. Adductors. we need to do rotators now. So we're gonna go to, we're gonna go to supine position so we can keep the camera rolling. So just lay back on your back, okay? All right, so now we are going to do, actually, I know you're tall, but can you move just a little bit so your ankles are even resting?
Yeah.
I'm gonna make you move back in a second. But, okay, so we know that if we're working on one side, we wanna flex the other side just to protect the low back. A lot of patients have pain in their low back when they're fully extended because it puts pressure on the lordosis. So I'm gonna put this here. He can either use the pillow or support himself, whatever he'd like. So now we're gonna go to rotators. I think I said I wanted to do. And for rotation and gravity minimized, okay, if I wanna have the patient do internal rotation, I'm going to manipulate to show them the femur and the tibia at the same time. So this is the motion I would like for you to do, is internal rotation, okay? So the internal rotation, I just passively showed him what I want. If I want to palpate the rotators, I'm going to find his trochanter, and I'm going to go slightly medial to it, okay? Slightly medial to it to feel the rotators kick in, okay? So I'm going to feel really, it's hard to feel any of the muscles in the rotation. In the external rotators, you're going to feel the glute max. But what I want to know is, are those tendons grabbing that trochanter and pulling them? So I'm going to feel the trochanter under my fingers, and that's palpation, the best palpation you could do. So go ahead and do that rotation for me. Perfect, okay? And I felt that trochanter in my left hand move. Okay, so I'm kind of palpating the tendinous insertion on the anterior portion of the greater trochanter. Now, the next one I want to do, and you know, this, and I forgot to show everybody, full range of motion really should be from external. I was rushing, excuse me, we have to do it again. So if I really want to get full range of motion, I want to start in external rotation and go into full internal rotation. So just to show you that more dramatically, go ahead and do that again. Perfect. Okay, so that would be the motion you're looking for. Now, for the opposite direction, so now I'm going from full internal rotation to full external rotation. So I'm going to place him back into that full internal rotation. I'm going to palpate the trochanter again, but this time I'm on the posterior side. I'm going to feel glutes kick in. Know your 6 deep rotators. Piriformis is a big one, but know that all of them you need to know for your exam, okay? So I'm palpating posterior to the trochanter. I should feel it slip into my hand. And you're going to do that external rotation motion I showed you, William. Perfect. And that's it. Okay. Now, for a 2+ in either direction, I want to be up at the femur. So my 2 hands are going to surround medial and lateral condyles here. And I'm going to rotate in the opposite direction that he goes. I'm not going to be on the tibia. I don't want to torque the knee joint in any way. So I'm going to protect that knee joint. And if I wanted to do, for example, he's going into internal rotation, all I would do is provide the resistance with both my hands around the condyles and rotate in the opposite direction as he goes into internal rotation. So he's set in external. Go ahead and do that. Internal. And then opposite direction, I'm here. Now I'm going to push into internal as he goes into external. Go ahead. And that's it. Okay, so that will be your 2+ for your rotators, surrounding those condyles. Okay? All right. Now what I'd like to do is move down to the ankle joint. So just come down just a little bit and you can stay. Yeah, perfect. Perfect, perfect. Actually, a little bit more. I want your heel on. Yeah, good, perfect. Okay, so, sorry Lola. I need to get out of the way. That's my dog Lola. All right. Let's move this here. And we're going to go down to the inverters and everters. So they're in supine. Get my paper out of the way. And you can do this in sitting. My stool's a little low, but it'll work. I want to support the calcaneus because the motion that they're doing is eversion and inversion. Okay? So what would it do? It would kind of drop into plantar flexion if I wasn't supporting it. But I want motion. I don't want to do it on the plinth because if they were really weak, they were in bed a long time. This is a real precarious place, and sometimes we have ulcers that set in here, so I don't want any friction. So I'm going to use my hand okay, to support. And I'm going to say to William, if I want to do eversion, this is the motion I'd like for you to do. I'm going to palpate peroneals on the lateral side of his tibia, over here, on my left hand, and I'm going to ask him to go from inversion to eversion. And that's it. That's your 2. For a 2+, I'm going to put resistance on the lateral portion of his foot here, and I'm going to ask him to push out into the same direction. And that's your eversion for a 2+. I'm going to go opposite direction. So from eversion to inversion, I passively show him what I want. Now, for this palpation, okay, we're talking tibialis posterior. It comes posterior and inserts here. So you see the malleolus, the medial malleolus. I'm just going to go slightly posterior and distal to it to feel for that tendon. So I'm going to set him into eversion. I'm going to support his calcaneus. I'm going to ask him to do that inversion motion. And he does it just fine, and I palpate it. Okay, so there's your inversion and eversion. All right, that's, okay. Now, probably we can do hip AB and adduction and supine, so working back up to the hip. Okay, so William, what I'm going to have you do, let me clear out some of this. We have enough room. I'm going to have him from here. Just widen out a little bit so that I can create more room, and if you needed to put the lower extremity on a chair off the plinth for more room, you could do so. But if I want him to do AB and adduction, obviously to do abduction, I'm going to start in full adduction. I am supporting his femur and his tibia, and I'm telling him to do abduction on his right leg. Now, notice I want the toes straight up. I don't want them to rotate out. This is another big compensation patients do, is use their external rotators. So you don't want that. You want neutral hip and you want no rotation. So I'm going to support as you go ahead and slide that leg out like I just showed you. Perfect. Okay. So this is your gravity minimized abduction. Okay. Oh, I'm sorry. I forgot to show you palpation. I showed him the motion, but the palpation is going to be at that glute med area. So I'm going to be right here in palpation as he comes and does that again. So this is what your palpation would look like. I go too fast. Okay, so go ahead and do that for me. So here's your 2. Keeping the leg as close to the plinth as possible. You want it in the correct plane. And I'm supporting the femur and the tib. So now that he did a 2 and I palpated and I know he can move, I'm going to move to the 2+. I want to give lateral resistance to the femur here for my 2+. So I'm still supporting, I'm supporting both, but I'm actually pushing with my left as he comes out into abduction. So do that, I'm going to give you a little resistance for the 2+. Perfect. Okay, so now let's go in the opposite action. Okay, so here's our abduction, and we're pulling in to adduction. Okay, so if I show him the motion, the next thing I want to do is palpate. Now, I could have my supination grip on both. This one's easier. I don't have to use my one arm to scoop as I did before, because I could palpate adductor magnus just superior to the knee joint here and still hold the tibia at the same time and hold the femur at the same time with my support. So go ahead and do that motion. I can palpate and I can support at the same time. Okay, so this is the hand, the left hand is the important one. So now I'm not going to move my hands, I'm just going to give him some resistance as he pulls in. I'm going to pull with my left hand. Again, I know you're on adductus magnus, but it's okay. We're on the very distal end, and you have a lot more adductors up here doing a lot of the work, so it's not that we can isolate one adductor. So go ahead and do that again. And I'm pulling as he goes. I know it looks like I'm not, but he's strong, so. All right, I think that's it for supine. We're just going to flip prone. I know it's going to be a long video. You ready to flip onto your belly? Yeah. Cool. Let me just do one thing. Move this. All right, so pop up on your hands and knees for a second. I'm going to slip this underneath your pelvis. Good. And I'm going to give you this at your head. So put your arms by your side and put your head straight down. Perfect. Okay. All right, so actually, William, don't kill me, but you got to come down just a little bit to hang your feet off. Okay. So here's the position prone. I always want the feet to hang off because we don't want to have to put support here. As you learn in positioning for patient care, I don't want him to be resting like this in plantar flexion with a lot of pressure by his toes. So this is optimal for positioning. And I'm going to start with glute max against gravity. So if I flex his knee joint, I'm taking out activation of the hamstrings and I'm focusing on glute max. So for glute max, it's hip extension, and as you can see, I made sure that he has a pelvic pillow to protect his low back. We don't want an increase in the lordosis to start off with, so you're protecting that low back with the action. Don't let him come up either when he does it. Just, you know, you want the stabilization at the pelvis to happen. So I'm going to support his leg here just so he doesn't flop down, and I'm going to just have my hand here just so that we don't have any rotation going on. So go ahead and kick up towards the ceiling like I just showed you. Perfect. Okay, so that's his 3 out of 5 is fighting gravity, against gravity position for your glute max. Now I'm going to give him resistance. My stabilization is going to be my forearm across his PSISs, and I'm going to meet him halfway. So come up and don't let me push you down. Okay, William? Come on up. Min, mud, and max. Whoop. Too heavy? All right, so he broke a little bit, so let's just go with that. So if he broke before my 5 out of 5 pressure, my max resistance, he was near max resistance, that would be a 4+. So you're constantly going over your grades as you practice. So it's good practice to not have a 5 out of 5 all the time. Okay, so now I'm going to go to the hamstrings. Hamstrings is done with knee flexion. Now, patellofemoral joint pain is common, especially in the lower extremities, and I'll tell you, I have some myself. So I'm going to put this towel roll in order for the patella to glide and not be compressed into the mat here, or the plinth. So I'm going to put this just proximal to the knee joint, okay? And I'm going to have him do his against gravity position for his hamstrings. So what I just showed him to 90 degrees is fighting gravity for the hamstrings. Beyond that is not fighting gravity, okay? It would be the opposite muscles, your quads, lowering slowly. So we have to pay attention to how gravity acts on, and remember your concentric from kinesiology, those principles carry through to here. All right, so right where I showed you to stop, William, if you can do that and bend your knee, right there, perfect, and lower back down. So that's his 3 out of 5, okay? So now I'm going to give that resistance for his break test. So I'm going to come here, I'm going to, again, it's PSIS that I'm stabilizing. He's going to come up and meet my hand, so do that action. Don't let me push you down, come into my hand. I'm going to stop him, min, mud, and max resistance for his quads. I'm giving him a little more resistance because you really have to fluctuate. We'll work on this in lab, but we have to have enough resistance for a big group like quads or hamstrings or glutes. You're putting more pressure, much more so than the rotators, or even at the shoulder when we're doing upper extremity, some of the pressure is a lot lighter. So it depends on the muscles and the group you're working with. So that was a 5 out of 5 for hamstrings. So let's do now the ankle joint. So here, from here to here, plantar flexion, with the knee flexed is soleus. So remember, we're still doing the same principle because gastroc crosses the knee, we're going to have it extended. I'm going to make sure that he doesn't drop down, so just a little bit of support or stabilization, if you want to call it, because it's against gravity, anterior on the tibia. So he's going to go ahead and point his toes up towards the ceiling, and that's your 3 out of 5 for soleus, okay? So now I'm going to give him some resistance. So I'm going to, on his plantar aspect, I'm going to meet him halfway. Come down, drop down a little bit. There you go. And I'm going to stabilize here so his lower leg doesn't move. Come up and meet my hand. Don't let me push you down. So, and he could fight me. Sometimes I got to get on the stool and give a little bit more resistance so it doesn't bother my shoulder. So protect yourself. But for time purposes, we're just rushing through. Okay, so now if I want to do gastrocs, I'm going to straighten out that knee joint, and I'm going to do it right here. Okay, so I'm going to say, okay, we're going to have that plantar flexion happen. So William, this is what I would like for you to do. Fighting gravity all the way, go ahead. Point that toe. Good, you don't have to lift up. Good. So that's a 3 out of 5. So if I want to give resistance, I'm going to stay away from the gastroc heads and stabilize proximal to the knee joint. He's going to come up, meet my hand. Don't let me push you down. Hold it, hold it, hold it. And that's your 5 out of 5 for your gastrocs. Okay? And that's it.